Hi there, everyone. Um, in this talk, I'm going to be giving you a bit of an overview in qualitative research, especially how we set up studies, how we know which studies lend themselves more easily to qualitative versus quantitative research, and how you might go about setting up your own studies, some of the different components that we need to consider. So, we're going to start off by discussing exactly what qualitative research is, then go a little bit into some different questions between qualitative and quantitative research, discussing then some methodologies and some methods, and finally some common pitfalls that I see as somebody who does a fair bit of work in conference abstract reviewing and also peer reviewing for journals. So the first question is, what exactly is qualitative research? Very simply, qualitative research is research involving non-numerical data. Now, this is opposed to quantitative research, which is often what we're trained in when we're in healthcare fields, especially medicine. Folks in medicine often have science backgrounds where they're used to dealing with numerical data, statistics, p-values, confidence intervals, things like this. Now, qualitative research is different. Qualitative research data is going to be things like words, books, texts, policies, interview transcripts, focus group recordings, narratives, reflections, social media postings. The picture down in the bottom left is a rich picture, which is a drawing, sometimes a schematic, a mind map, etc., that's drawn by an interviewee during an interview and coached by an interviewer. Qualitative research can also use videos, photographs, even direct observation, so-called ethnography, where a researcher goes into a specific setting, observes the world around them, takes notes, speaks to people, and really gets a sense of what's going on in a certain group, a certain culture, a certain setting. Now, this is opposed to quantitative research. This is a study called the Challenge Trial, which came out last year showing the benefit of exercise, especially increasing exercise after a colon cancer diagnosis. And for folks who are in medical fields, this may look like the more typical research you're used to seeing. We have our Kaplan-Meier curves, we have our hazard ratios, our p-values, etc. You see that this is very numerically based versus the qualitative research, which is non-numerically based. Now, when we're trying to figure out if our research question, if our study, if our area of interest lines itself more nicely with qualitative or quantitative research, there are a few things that we can consider. Now, the first is ontology. Now, for those of you watching this who have social sciences backgrounds or backgrounds in philosophy, for example, this may sound more familiar. For those who are trained in the more um, basic sciences, I guess we can say, you do this when you're designing a research study. It's just there are a lot of assumptions, a lot of things that are standard, so you may not consciously be going through this thought process. That said, regardless of which direction we're going to go in, we want to start with our ontology. Now, ontology is how we answer the question, what is reality? What is real around us? And if this is the first time that you're hearing this, please bear with me because I promise it's going to make sense in a few minutes. Now, when we're talking about quantitative research, the ontology that's typically used is called positivism or positivist ontology. This means that there's a single objective reality that we are trying to find. For example, the research question, does this drug improve survival compared to placebo? You can see that that would be answered with yes or no. There's one absolute truth that we are trying to get to, and we're going to use numbers, we're going to use statistics and p-values and confidence intervals to try and find that one singular truth. Now, on the flip side, there are other ontologies. A common one that we could use in qualitative research, for example, is called subjectivism or subjectivist ontology. This is the thought that reality is shaped by the experiences and perspectives of the people who are living through it. So, for example, how do patients experience delays in clinic? You can imagine from person to person, this is going to be slightly different. Now, in a qualitative study, we're often trying to get to some common experience that people have, understanding that no two people's experience is going to be exactly the same. If we consider the phenomenon of delays in clinic as well, we can understand how physicians or nurses or receptionists experience delays in clinic is going to be very different from patients. And it doesn't mean that one way is right or wrong. It simply means that we all have different experiences and perspectives which shape our version of reality. And these are the questions and these are the phenomena that qualitative research is trying to get to. So once we've figured out how we're going to define reality, we then need to look at the epistemology, which is how do we determine reality or how do we determine knowledge? Again, on the quantitative side, this is usually through positivism. Now, positivism is telling us that there's one single absolute objective truth that defines reality, and now we want to find it. So we're going to use empiric scientific method. We're going to use systematic trial and error until we find that one singular truth. For example, at what temperature does water evaporate? Now you can imagine that study, that research question is going to give us one number, 1 degrees Celsius or 1 degrees Fahrenheit. And if we use systematic trial and error and set up our experiment very carefully, we can find that one true value. On the flip side, qualitative research may often use something like constructivism, where reality is socially constructed between the researcher and the participants or the researcher and the data. And that it's that back and forth through which you're going to develop an understanding of the phenomenon at hand, you're going to develop an understanding of your research question's answer. For example, consider the question, why do medical students give attendings presents? If I wanted to answer that question, I may take 20 medical students and ask them a series of questions. And in the conversation, in the back and forth, that's how we're going to create an understanding of the answer to this question. Now, as you can imagine, taking things up a notch, if I, as an attending that medical students have been known to give presents to, were to ask this question to 20 medical students, the responses and the conversation and the understanding may be different than if I take another medical student and have them ask their fellow medical students. Now, this is getting into something called reflexivity, which we're going to talk about in a moment. But again, it's not right or wrong. It's just an understanding that a researcher or an interviewer or somebody interacting with data or with participants is going to develop can differ depending on who the participants are and who the researcher is. And these are all just important things to consider when you're setting up the study, because it's all part of the study that you're doing, isn't it? It's all part of the question that you're answering. Now, another reason that this is important is we have a strong need to match the methodology and methods, which we're going to speak about in a minute, with the research paradigms, so our ontology and our epistemology. As you can imagine, if we're trying to use qualitative research to find that one absolute truth, we're going to run into trouble very quickly. On the flip side, if we're trying to develop an understanding of a social phenomenon while looking for the one absolute truth, well, there is no one absolute truth to social phenomena. It really depends on who's living it, right? And what their setting and what their personality is and what characteristics and what they've experienced in the past, right? Now, just to hammer this home, some examples of quantitative research questions, right? Looking for that one absolute truth. Does this drug work better than placebo? Yes or no? Have student test scores improved with the new curriculum? What percentage of applicants are successfully admitted to medical school? Right? There's one absolute truth that we can see. On the flip side, qualitative questions. What areas for improvement do students see in the medical school curriculum, experience, study space? Now, there may be one answer that all the students give, which would point to quite a drastic problem. But in general, people would be seeing things slightly differently. How do patients experience receiving chemotherapy? What occurs during interprofessional conflicts in medical oncology clinics, right? What is the common experience? Do numbers make sense here? Or do words, pictures, and videos make more sense? Now, switching gears here to the methodologies and methods, because once you have your research question, once you figure out your ontology, your epistemology, if you're going to take a more positivist approach or a more qualitative approach, we get to come up with the methodology, which is the action plan for research. Includes the paradigm, includes the orientation, also includes the methods, also includes a plan for analysis as well. Methods refer specifically to the data collection and to the data that you're going to be getting. So what are you going to be dealing with? Methods is part of methodology, but we need to spell out both of them. Now, there are a lot of methodologies out there. There are textbooks upon textbooks of qualitative methodologies. Depending on the field that you're working in, depending on your specific research question, some of them may make more sense for others. Yeah, some of them may make more sense than others. For example, if you work in the social justice world, there are methodologies specifically looking at racial discrimination, racial disparities, gender disparities, for example, versus if you were working in something that's not those fields, those methodologies may not make sense to use. Now, that said, we can often boil things down by always focusing back on the research question. What is your research question? What kind of answer, what kind of output are you looking for? Now, most qualitative methodologies involve breaking down data into summary points, a process called coding, and looking for connections between those codes. Again, there are many different ways to do coding. Here is an example from a transcript that we have. You can see here that this is an interview transcript. We're taking each sentence or each couple sentences that the participant says and summarizing that with one word. Codes are often 5 words or less. Depending exactly how you're doing coding, you may use verbs, you may try to use single words, you may use direct quotes from what the participant is saying. But then we can take all those codes at the end. Once you finish coding, you'll have a whole list and try and put them together. For example, in this study here, you can see here in the colorful text, those are all my different codes. I've taken them on an Excel spreadsheet and I've batched similar codes together and then given them a title. So you see it down here, real world awakening, high stakes environment. In this particular example, these are called categories. You can see I've taken all my codes, grouped similar codes together to form categories, and then I can take my categories and answer my research question. In fact, this codes to categories is a kind of qualitative methodology called qualitative content analysis. Now, this is different from quantitative content analysis, which is where you're going through data looking for something specific, for example, the names of superheroes, counting out how many superheroes are mentioned how many times. And, Superman is the most popular superhero because he's mentioned 50,000 times, but Batman is only mentioned 500 times, so he's not as popular. This is a different kind of methodology. This is quantitative, not qualitative. Qualitative content analysis is going through, doing your coding, getting a sense, getting an understanding of what the data is showing us, and then combining those codes into categories to answer the research question. We also have thematic analysis, which is similar, and there's lots of debates in the qualitative research world about how exactly content and analysis and thematic analysis differ. Now, for me, thematic analysis is similar, but instead of categories, we combine the codes into themes. Themes are usually wordier. They're often a sentence, a full sentence, or a couple of sentences. And there's usually fewer of them, so maybe 3 to 5, versus for categories, you could have more. On the flip side, again, we have qualitative description. Now, as you can imagine, sometimes coding depends on the researcher, who is doing the coding, right? Who is doing the categorizing, how they're interpreting the data. In certain studies I've done, certainly it's good to have everybody on the study team review the data, read through the data, so you can have high-level discussions. But often there will be some sort of editorialization. For example, a recent study I did looking at pre-medical students, and some of the perceptions of what's needed to get into medical school and some of the perceptions of what's needed to be a successful physician. In my experience, having gone through medical school, residency, fellowship, and now being a consultant, I could tell some of what the medical students were saying was factually inaccurate, even though they believed it. In qualitative description, we are staying very close to the data. We wouldn't be putting any sort of this editorialization or this interpretation of the data. We're getting a much more superficial, surface level description. Now, again, contrasting that again with grounded theory, which is a very detailed understanding of a phenomenon, a very deep understanding, very deep generation of a new theory, a theoretical framework of new knowledge that's filling some sort of gap. The tenets of grounded theory include constant comparative analysis. So you're going to take your first data set, your first interview transcript, whatever you have, you're going to analyze that. Then you'll get the second one, you analyze that. And then you go back to the first one and you're going to analyze that again. And then you're going to get your third data point, analyze that, and then go back and analyze the first and the second one again. So it's very labor intensive, but you do develop a very deep understanding. We also use theoretical sampling. So as you're doing your analysis, you pick your next data point based on what the previous data points have been and what you think you need next in order to build your analysis. Finally, we have phenomenology. For the philosophers out there, this is the study of the pre-reflective lived experience. What does that mean? When we're writing articles, reflections, diary entries, even speaking to an interviewer, often we're reflecting on things that we have lived through. We're putting our own editorialization on it. We're mentioning regrets. We're mentioning things that we're proud of. Phenomenology uses very distinct, very carefully worded questioning to try to get to the experience in the moment before reflection occurs. This is particularly important if we're looking, for example, at setting up supports for healthcare workers, for physicians, for students who may be struggling in the moment. It's more helpful to know what they're living through in the moment rather than interviewing people who have already found ways to cope, which may not be applicable for students or whoever in distress in the moment. Now, narrowing things a little bit into methods, there are many methods, as I alluded to in the beginning. Some of the more common ones include interviews, and there are different kinds of interviews. There's unstructured, where you start with a general prompt and then follow the interview where the participant takes it. There's semi-structured, which is you have an interview guide, but you can deviate from it. You have structured interviews where you don't deviate from the interview guide. You can have one-on-one, two-on-one if you're doing with a couple, virtual, face-to-face. There are different options for interviews. Focus groups is when you have a group of participants and you may have yourself as a researcher, as a facilitator, maybe some other facilitators, and you are listening and transcribing, going through the conversation between participants and building on the conversation between participants. We can, of course, use published texts, books, documents, essays, social media, photographs, rich pictures, and then the direct observation I mentioned before as well. Now, as I said in the beginning, we're going to go through a few common pitfalls that I see when folks are doing qualitative research. One of the biggest ones, which is why we spent so much time in the beginning on, you have to know what your research question is and whether it lends itself more appropriately to qualitative approach or quantitative approach. You cannot answer a qualitative question quantitatively. For example, if your question starts, what's the experience of? How can a p-value boil down human experience, right? Along those lines, we want to make sure that our methodology, our method, and our research question match. For example, if I want to look at regrets that fourth-year medical students have, and I'm going to use phenomenology, and I'm going to use direct observation, that might be hard, right? Because regret is not something that people usually exhibit on a daily basis. Phenomenology is about lived experience, but regret is necessarily something that you've reflected on, something that you've already lived through. So this is called congruence. When everything lines up, we want to make sure our research studies have congruence. Pitfall number 3. So mixed methods can be challenging. There are a few examples where mixed methods, so usually both quantitative and qualitative, is appropriate. For example, if you need to do a needs-based assessment, that's quantitative, and then the qualitative study. If you're doing qualitative needs-based assessment, then the quantitative study. If you're doing some sort of major quantitative clinical trial, and then you want to get a qualitative sense of patient experience on that treatment, drug, whatever the case may be. Along the same lines, I see a lot of people doing survey studies. Again, you have to know why you're doing the survey. A good survey or a good scale needs to be validated. Now that means it needs to go through a rigorous process of checking with experts in the field, with sample participants, to ensure that your wording is clear, that the way participants are answering the questions is the way that you intended, to ensure that the information that you're getting is going to be usable to answer your research question. A lot of the time, again, we see surveys being used to analyze how effective a teacher is, or a curriculum is, or an innovation is. And you just have to be careful that that survey and the way it's designed is giving you the depth of information that you need and is appropriate for your research question and your methodology. Often, if we're looking for anything beyond a superficial overview, a survey isn't giving us that back and forth that allows us to build understanding or create understanding of a phenomenon or answer a research question. So, sum total here is mixed methods or surveys could be used. You just need to be careful and know why you're using them. Qualitative research is a skill that can take months or years to develop. So I think a lot of the time in healthcare, especially in medicine, we have a tendency to discount qualitative research, thinking it's not robust, thinking it's easy to do, and then trying to do it, but unfortunately doing it in a manner that may not be correct and may not result in meaningful conclusions or meaningful data. When in doubt, I always encourage folks to collaborate with qualitative researchers. There are a number out there. There are a number of fields where, professors, researchers are highly trained in qualitative research, and there's nothing to say if you're doing medical research, if you're doing education research, that you have to stay with folks who are in medicine. I've had the privilege of collaborating with some wonderful communications experts, linguistics experts, education experts who are not medically trained but are very, very skilled in qualitative research. Pitfall number 5, so I touched on this before, reflexivity. So with qualitative research, we have to be very mindful of our status and our experiences and our perspectives, perceptions as researchers. Often this is something that will be declared in a research protocol, in a research manuscript. It can also be helpful to consider this when you're setting up your research team. For example, if we're doing medical education research, it can be really helpful to have some folks in the medical education spectrum, so a medical student, a resident, depending who you're studying, who can lend that perspective when you're looking at the data. Similarly, I am mindful of my status, and when I'm doing interviews, for example, with medical students, I will try to lower my status. I will bring in examples, for example, of times that I have messed up or if I've experienced moral distress, depending on what exactly we're trying to uncover with the study. Um, Always try to be mindful of your perspectives, your experiences, but also the perspectives and experiences of the person sitting across from you. Finally, a quick note on using software or AI as a methodology. So there are a lot of qualitative software out there, Quirkos, NVivo, Atlas, to name a few. These can be really helpful for storing data, for organizing data, but the software cannot do the analysis for you. The software is not a methodology. You still need to be doing your thematic analysis and using the software as you would an Excel spreadsheet, a Word document, or even pen and paper and sticky notes, as was done before the age of computers. Similarly, we've spoken a little bit about how your perspective, your lens as a researcher is really important in qualitative research. Now, I can certainly feed data into an AI and ask it to find me patterns. But the problem with this is what perspective, what lens is the AI using, right? The AI is simply a computer that has been trained to look for patterns. And while it can be helpful to see if there are patterns that you may have missed, the AI is not a replacement for doing the work yourself. The AI has no lived experience, right? The AI has no perceptions or perspectives or orientation of its own. The AI cannot interpret the data. The AI can only look for meanings in a very quantitative computer-based way. So AI is as a tool if you must, but AI cannot be a replacement for doing this work yourself. And with that, I hope that this talk has given you a bit more of an overview as to some of the tenets of qualitative research and some of the things to consider when you're setting up a qualitative research study.